Good afternoon, everybody. Happy Wednesday. So for those of you all that have never saw a live from myself, you've never came across my page before, this might be your first time. I would just want to introduce myself. My name is Melshani Collins, and I am the CEO and family advocate of the G.R.A.C.E agency, where we advocate for families that have child welfare cases. We also help fathers to gain rights to their children through legitimation, and we connect families to local community resources. So the name of my business is called Giving Respect and Compassion Every Day. And how that came about was when I worked for the Department of Family and Children Services for over 7 years. One of the things that I realized is that families felt like there was a power dynamic when it came to the families working with the department, right? There was a negative stigma. They were already in a vulnerable situation and they felt like they were judged. And so what I decided to do was, after I left the agency, I decided to be a liaison to bridge the gap of communication between the families and the agency. And so that's how we got Given Respect and Compassion Every Day, because I believe that families need the same grace, right, that we all need, especially when they're going through hard times or they had a case that was called into them. And so if you are looking for those services, or you need help with a modification of child support, modification of visitation or custody, contempt or paternity petitions, because we don't just do legitimation, but we also do those petitions as well. We do divorce petitions as well. So if you are looking for those services, or you need a voice, you need somebody to advocate from you outside of the agency, definitely give us a call at 678-729-7261, or you can visit our website, which is www.grace-ga.com. And so you all, we are going to get started. So every Wednesday we do something that's called a Let's Talk Wednesday, where we allow different businesses or organizations to showcase to you all the services that they have to offer and the resources that they have to give to you. And the reason why we started doing this was because I realized that there's so many resources out there that everyone does not know about them. Neither do I, right? And so I just started networking at different wellness events that happens, in the community, or just while I'm out networking and partnering with people. I started realizing that, hey, if the community isn't aware about these resources, I need to bring the resources to the community. And so that is what we do every single Wednesday. We just showcase a different organization where they can give you some information about their company, right? Where they're located, what's the criteria for their services, what type of services they have to offer. And so we feature somebody different and new every single week. And so today, you all, we are featuring CareSource. And so I'm going to join Mr. Reginald Johnson in just a minute, but I'm going to give you a little bit of background information on how I met him. I met him at one of the events actually a while ago. And ever since then, he gives me information about different events that goes on in the community. He's a big advocate when it comes to fathers and men's mental health. And so I thought it would be great to feature him on today so that he can give you more information about CareSource, which is a Medicaid insurance plan, which a lot of families in Georgia have. But I wanted to let him speak from his mouth and give you all information about what he does at CareSource and the background. Okay, so give me 1 second as I join him in. Mr. Johnson, there you go. Can you hear me?
Hey, yes, I can hear you. Can you hear me?
Yes, sir. I can hear you now.
Okay, great. Yes,
Hi.
ma'am. Yeah, I was just trying to get to a quiet space so I can sit down and we can have this conversation.
Awesome, awesome, awesome. Well, first and foremost, thank you, Mr. Johnson, for choosing to speak at our Let's Talk Wednesday. I know that you are busy and you have stuff to do, but I thought that you'll be the perfect person that would be able to give more information on CareSource and the resources and the services that you all have to offer.
Absolutely. Yes, ma'am. Yes, ma'am. Thank you very much for having me on. And uh, hello, everybody out there in cyberspace land who's watching.
Absolutely, absolutely. So, if you can, I did do a brief introduction on how we met a while ago at a community event, but if you can give them a little bit of background information on who you are and what you do for CareSource.
Yes, ma'am. Yes, ma'am. So, yeah, my name is Reggie Johnson. I'm the health promotion specialist for CareSource with a focus on school-based health. So, yeah, oh my Lord, I can't remember the exact event we met at, but I know it has something to do with fatherhood, and
Yeah.
so because you are one of the diligent warriors who are working to help us out on that front, and I do appreciate that. But yeah, excuse me, as I said, I do work for CareSource, and CareSource, the simple explanation is we are a nonprofit health insurance company,
Okay.
and we operate in about 7 different states, based out of Ohio. But here in Georgia, we operate. We have three main products. We do Medicaid, PTR for Kids, Planet Healthy Babies. We also do Marketplace, aka Obamacare, and we do dual eligibles, which is for people who have Medicaid and Medicare.
Okay.
But yeah, but the vast majority of our members in the state are Medicaid, Peach Care, Planet Healthy Babies, Georgia Pathways, things of that nature. So essentially, what happens is when you're in the state of Georgia, if you qualify, and everything is still based on the state qualification. So if you go to the state of Georgia, if you're pregnant, you lose your job, or you have certain criteria that you have to meet. If you are eligible, then you get approved for Medicaid, and once you get approved, you get automatically assigned to a plan. There are three options in the state of Georgia. So the person gets automatically assigned to that plan. They get a health plan and a doctor. Now they could either stick with that plan and that doctor, or they have a 90-day window to switch. And I tell people all this information comes in your mail.
Mm-hmm.
Now, of course, the main question I get is, well, which plan is the best? What's the difference between this plan and that plan? And I'll say, well, the health benefits are exactly the same because all we do, the state, it's Medicaid. The state
Right.
of Georgia has a list of things that are covered and that they'll do, and so they give that to us. And then then it depends on the doctor. So again, that's we do dental, we do vision, behavioral health, uh prescriptions, emergencies, like all the insurance stuff, case management, we offer that. The differences are the additional benefits and the doctor that you want to see.
Mm-hmm.
So and perfect example is if a family of three, let's just say they're having a fourth child, and they're the parents get pregnancy Medicaid right from the start or whatever. The moment they get assigned, then they look at the doctor. Now, if it's not the doctor that you currently see,
Mm-hmm.
then you either well. Let me back up. The easiest way to pick a plan, I tell people, is to talk to the doctor that you see. So whichever plan that you have, if you get assigned to CareSource and you go to Dr. Jones and Dr. Jones doesn't take CareSource, then you either have to switch doctors or you can switch plans. And
Mm-hmm.
then, like, as I say, the doctors they take, and most doctors I know of the hospitals and whatnot take all three of the plans. So it's just essentially, and say it's which the preference for the doctor, whichever specific needs you have, the benefits, and so on and so forth. And so the additional benefits that we have at CareSource, and I'll list a few of them. As I said, we do our dental, vision, behavioral health. Now we have expanded dental and vision benefits for any adults who may be on our plan, and that's typically pregnant women or certain families or whatever that if they get the regular Medicaid, and that's just regular Medicaid, not Medicaid and Medicare or SSI, disability, things like that. Just regular Medicaid.
Mm-hmm.
We have expanded dental vision services for them. We also do things like life services. As I said, we are a nonprofit. So our members, any member 16 and older or family members, so older sibling, father, mother, even if they're not covered, as long as they're in a household and related to that CareSource member, they get a life coach that follows them for up to 2 years. We have things, we offer like resume help. We have a Job Connect program. We have about 250 employee partners around the state. We work with WorkSource Georgia, the different WorkSource satellite offices in different counties. Um, the technical schools, Georgia Perimeter, Atlanta Tech, Georgia, like different schools around the area. So any of our members or their families who, whichever career path you want to take advantage of, you let the life coach know. They'll get with you. Any program that you have, and that's anything, be it, as I say, through WorkSource. We have things like, the IT tech, CDL, patient care techs, things like that, or you want to go to any type of career that a person may want to get into. The life coaches, we have those connections and those partners that can put them into that. We also do things like free Girl Scouts, free after school program at the Boys and Girls Club. We do free family membership at the YMCA, as well as we have a partnership with Fifth Third Bank. So our members and their families can walk into any Fifth Third Bank branch in the metro Atlanta area, actually in the state of Georgia, show them their ID, they get a bank account, and they have access to all the financial services that Fifth Third offers. They get a debit card. They can use it at Racetrack, Kroger, CVS, things of that nature. And they also have access to career counseling, credit education, financial education. So those are some of the benefits that we have for our members. And as a health promotion specialist, primarily working with school-based health centers,
Mm-hmm.
I will work with the school that actually has school-based health center, and the cluster of schools, or the community, because it's a federally qualified health centers. That would be like your Family Health Centers of Georgia, MedCura, which is formerly Oakhurst, Whiteford, Southside Medical. Those are the four main ones in Metro Atlanta that operate school-based health centers. So I work with those schools to help improve the relationship between the school, the health center, and the community. So we work with different school groups. Depending on where they are, because we go from Head Start all the way up to high school.
Oh
So
wow.
yeah, so we focus on early literacy, work on food insecurities. Once they get into the middle school and high school area, then we start working on things like uh, you know, uh, that social emotional intelligence. And
Mm-hmm.
then once they get to the high school, at some point, like they have the different clubs or whatever. It's like FBLA, VICA, 4-H, or whatnot. So any students, especially particularly those who are going into the either social work or healthcare fields, like we'll work with them to have different volunteer opportunities for them. We also have our Wellness on Wheels, where we partner with East Chester Family Services and Kids Block on Wheels to bring our mobile units, like what's mobile units, out into the community to provide opportunities if our members and other community members to actually, if they can't make it to the doctor, to bring the doctors out to them to help with them. And for a personal thing, I know you probably know, whenever I work with the school or any organization, one of the first things I'll ask is, do you all have any fatherhood involvement programs? And so that's the thing, trying to get those in there. So that's what I do for CareSource, some of the stuff that we do, and work and connect those people with the services that they have. And then also, as I said, we encounter instances where people are uninsured. Like, we do have independent agents, so we can get them linked to a marketplace plan if they qualify. Georgia Pathways, which is a new program for many adults to get Medicaid, Plan for Healthy Babies, or if they have, let's say, dual eligibles, we can work to get them. But at some point, wherever a person is on their journey, we have something that can assist them.
Okay. Awesome. Awesome. So I heard you say that you are connected to some other entities that have school-based health services.
Yes.
Now, is that only in a certain area? Because I heard you say in Atlanta. Is that only in the inner city of Atlanta, or is just based off of where those school-based health services entities are located?
Well, yeah. It essentially depends on where they're located. Like currently, like we have like North Clayton High School, Burnett Elementary School in Douglas County, King Middle, which is in city of Atlanta. But there's some all around the state, like Albany area has operates school-based health in Albany. There's some in Columbus, Georgia, Savannah. So basically, all the wherever there's a many federally qualified health centers do operate those around the state. Those are the primary ones here in Metro Atlanta, but wherever you are. Actually, 2 weeks ago, I went to the national conference in DC. So school-based health, there's the national administration. So school-based health is something that's really big that many states around the country getting in, and Georgia's like, and we're really on the ground level. So those, and of course, it takes money. So
Mhm.
whichever, they identify the schools that have the greatest needs in the communities, and then they work with them, and then they, we'll say it's the school, the center, the school, and the community.
Okay. Okay.
Uh-huh.
Got you. So, because I was just going to ask you, is there a way that if a school is in need of those services, but they are not connected to one of those school-based health centers, are they able to, I guess, reach out and try to find out more information about how their school can get connected to the services that CareSource have to offer? So I guess they would have to be in that area to receive those services.
Well, yeah, it would depend. It would depend on the schools. As I said, certain schools have the centers, but then the centers may serve like the clusters, certain schools in the area.
Okay.
So, it's the idea. But those school communities that may not have a school-based health center, or who may not have one in the like within their within the cluster, then we from that area we have different layers, and then that's where the Wellness on Wheels comes in, because we can coordinate to either have Eastchester or Kids Doc on Wheels bring the mobile unit to those schools, or
Okay.
we can find whichever federally qualified health center or whether health provider is in that area, and we can work on connecting them to that, because what that is we want to make sure that our members are taking care of their overall health. you know
Right.
and as the insurance company, of course, we want to make sure that our members utilizing their benefits, going to the doctors, getting the well child visits, mammograms, blood pressure checks, A1C checks, and things like that. Make sure that they get that. But the issue is, like many times, you have we call them social determinants of health. So we have to make sure that the families are able to actually even get to the point where they can do that. And so if there's not a center in there, then we can work with the different mobile units, or have different teams come out. So like we can have like immunization days, or if they have an event. And one of the things that I do is, like, I go to the school, we can plan an event and say, okay, well, on this date, and I can work, and we can have the members come out and get those done. So even if there isn't a health center in the school, there are ways that I can work with them to make sure that they get that taken care of.
Okay. Oh, that's awesome. That's
Yeah.
awesome. Now one of the things that I heard you say was that when you go into schools and you start working with them and introducing the services, one of the first questions that you ask them is, do they have any fatherhood programs in
Yeah.
that school? Give me your reasoning on why you asked that question and what's the importance behind it.
Well, so one thing I noticed with CareSource here in Georgia, because and I don't know where the people who are watching this are from, but many states in the area, they did Medicaid expansion. So you have people in different areas who qualify for Medicaid, and they can get those health services and whatnot, and then they have plans. But in Georgia, the particular type of Medicaid that we have, for the most part, most of our members are pregnant women and children and what have you. And many of the programs that we have support them, which is understandable. As I always say, those are the two most vulnerable members of our population, especially in Georgia,
Mhm.
when our maternal and infant mortality rate is like amongst the worst in the world. Not just in the
Wow.
country, but you have, and I mean, you have like countries like Uganda and places like that, where it is a child is more likely to be born healthy and survive than in Metro Atlanta.
Wow.
So yeah, and
Crazy.
yes, it is crazy, because there is and it is epidemic around these areas, and if you notice, a lot of these are not topics that you're not hearing certain political figures talk about, because there's always a push on improving the family and so on and so forth. But it's like, well, according to the March of Dimes, Metro Atlanta, state of Georgia overall has an F- grade. So you talk about protecting and families, but you have Black women and children who are dying in droves around the state. So
Is that
and
is that due to a lack of access of care, or
yes,
is that due to a lack of advocacy on behalf of the mother receiving the care?
it's all of that. Lack
Okay.
of access, lack of education, lack of empowerment, just lack of a lot. Well, I got to put it that. Well, this is America. There's not a lack of resources.
Right.
There's not a
Right.
lack of anything in America. It's a lack of access, and many people don't know that they have access to these things, or they don't know where to go, or when they do go, they don't know if something happens, or if they don't get treated the way that they want to get treated. They don't know how to fight for them. Excuse me, fight for
Mm-hmm.
themselves,
Mm-hmm.
advocate for themselves. So, CareSource, we work with our partners, with the different boards of health around the different counties. We help healthy mothers, healthy babies, helping mamas, Atlanta Doula Collective, all those organizations that work towards overall maternal and infant health. We work with them, and they're in the schools, and the families through DFACs and places like that. They have that covered. But one thing that I noticed is that many of like in many of these instances, they'll have things for the mother, things for the children, but the father is completely, nobody has anything. That people will say certain things, but there really haven't been any ongoing long-term programs to support, empower, and basically just recognize these dads. And of course, I know not every not every family is a traditional nuclear family with the mother and the father at home. Sometimes the father is at home, he may not know, he may not have that empowerment, or he may not know where to start. The father may be non-custodial, but still may be active. Or even if the father is non-custodial, not active, there's a way we can identify, find
Mm-hmm.
out, and see if there's any. But well, first off, because it has to be the desire. That you can't make anybody do what they don't want to do.
Right.
And and this has been my experience over the years. That many of these quote unquote deadbeats. It's not that they don't want to do anything. Many of them they want. They just have no idea where to start.
Absolutely.
And so I'll say, well, and one of the main, one of the main places, the easiest places to get is in the schools. So we start with the schools and say so. And I'm a part of an organization called Fathers Matter ATL, which is about 40, 45 different organizations around the state, the country actually, that, but most of them in the state of Georgia to help us support these fathers and men. And one of the groups that we work with is called All Pro Dad. Like that's a nationwide organization. They'll come in and support fathers. We have organizations like Furthering Fathering, Fathers Incorporated, Father Movement, your organization, because many of these questions men they don't know where to go, and
Mm-hmm.
some of them, some men just sort of like feel kind of like awkward asking for help. So that's why I would just say, well, I won't wait for you to ask. I will offer it. And then we go in it. In many of the schools, I'll say they won't have anything, but they'll say, hey, I'm very interested in having it. So once we get that started, then a lot, and many of the dads and the fathers, they're excited because like nobody's ever really talked to them, especially not on this level, because
Mm-hmm.
things dealing with directly with children and care and medical and education, those things have been traditionally left to the mom. I'm saying, well, if you have all like these important things that the children need done, but you're only expecting half of the parents to take care of. That's why half of the stuff is getting done. So
Absolutely, absolutely. So when you go into the schools, and just introduce your services and inquire about the fatherhood program, are there any challenges that you face with trying to just make sure that the services are equitable to the children, parents, that they're available to get people to participate in those?
No challenges. Well, I haven't gotten any pushback from like any administrators or school or anything. Like the schools are always active and willing and eager to get started. The communities are good. Sometimes it's it's just um, figuring out the right time because many dads work during the day, or some
Hmm.
of them like they may not be custodial. Some dads only get their children during the summer, so it's just kind of like a just a matter of reaching out, and then once we have something, just having the continuing ongoing support and things for them to do, activities and so on and so forth. But overall, there really haven't been any barrier or obstacles. It's really been active because many people understand the need for this.
Absolutely.
Mhm.
Okay. Okay. So we were talking about the different things that you are a part of. And one of the things that I want to talk about was the Fathers 3-on-3 basketball tournament, which I
Yes.
know a lot of men would be interested in. That seems to be a pastime, a stress reliever, a brotherhood that I can understand as I am a female. So give us some more information on that tournament. Oops. Hold on. We just got disconnected. Thank you, Sherry. She said Fathers Matter ATL is a wonderful group. Absolutely. Absolutely. There we
Can
go.
you hear me?
Yep, I can hear you.
Okay, I'm sorry, I'm back. Yes, man. I
No
was trying
problem.
to see if I go to a different place. Yeah, so yes, this on Saturday, August 3rd
Okay.
at Sequoia Middle School in Riverdale. We will be having our Fatherhood 3-on-3 tournament. So we're inviting different fathers from different organizations from around the metro area to come out and participate. Now it's there's $100 registration for a team,
Okay.
and the first prize is $500. The second prize is 300, and third prize is 200. So each team must consist of at least three fathers. You can have up to five in case you want to swap out, but up to three fathers, and they we play round robin style, not round robin, but yeah, the tournament style. And at the end, we'll present the trophies and medals and the money photo op. But essentially, what it is, this is the third time we're doing this, so it's an opportunity for the different fatherhood organizations to to collaborate, to connect, to socialize, bring the families out, and just to get the message of fatherhood overall, but Black fatherhood specifically out there, and let people know that we are out there and we are ready to make this happen.
Absolutely. I think that that is great that that's something that you're doing, especially for the Black fathers, because I feel like they are almost invisible when it comes to families, when it comes to services, when it comes to
Mhm.
getting the help that they need. They are almost non existent, but they're out there.
Mhm.
One of the things that you said earlier was that the fathers, they're not just deadbeats. A lot of them are just scared because they don't have any information on what to do, how to
Mhm.
move forward, and they do feel some type of way about asking for help. Um,
Exactly. and,
so this
and
is
and they're
good.
scared. They're like the moment, like, and if you miss a payment or something happens, up, you go into jail, your license gets suspended, and then yeah,
Yep,
so it's like,
absolutely, absolutely. And another thing, I know you're saying that you talk, y'all have a lot of different services, and I should have asked this earlier, but a
Mhm.
lot of people in the community were interested about the over-the-counter rewards program that you
Hello.
have. If you take your child to the doctors regularly, you get, whatever kind of money that you can use. Do you have information on that and how people can get in that program, how they can join the Over the Cars Reward program?
Okay. Hello.
Yes, can you hear me?
Yes.
Okay.
Okay. Yeah. So you were asking. So yeah. So you were asking about
The over-the-counter rewards program.
Oh yeah, yeah. Oh yeah. Okay, yeah. So the rewards program. Yes, ma'am. Sorry about that. Yeah. So with that, we incentivize certain parts of our, the benefits. So going to the doctor, there's a list of different health screenings and other health related activities that a member can complete and earn actual money. So there's a reloadable gift card, and so for like prenatal, postpartum, well child visits. If you have an asthma diagnosis, keeping asthma appointments, diabetes, like things of whatever case management and health issue that you have. If the person achieves those, and then the provider sends the claim, and once we pay it, then a certain amount of money goes into that gift card, and that's just for keeping up with those appointments. And then that money can be used for household items, so they can use it, for over the counter medication. They can use it for things like household cleaning items like Clorox or toothpaste, washing detergent. They can get diapers, baby wipes. They can even get certain medical, food items like healthy food choices or whatnot. And so they can earn, and they just updated the numbers. I have to look, but they can earn up to like pregnant women or new moms can earn up to like $300-400 over the course of the year for those. So yeah, that's what we do for our members. But it's voluntary, and make sure that they have to be enrolled in it.
Right. Got you. Got you. Okay. Yes, and I want to let the families know out there that that is real. So if you do
Yes.
sign up for it, they will send you a card in the mail. And if you take your child to the regular appointments that you should be taking them to anyways, the money will be deposited. Give it a little bit of time, but it will be deposited on there, and you can definitely use it for household items that you may need, whether it's shampoo, body wash, diapers or wipes or anything
Yes.
like that. So definitely. And then the last thing, Mr. Johnson, that I want to talk about is the Black Men's Wellness Day that is happening in September, which is
Yes.
very interesting because I was glad to see that there's something that's specifically just for men, with a lot of different organizations and vendors joining that event. And it looks like it's going to be a really, really popular event. Can you give us more information on that and how they can be a part of it?
Absolutely. Yes, ma'am. Yeah. So, yeah, and this is the fifth year, I believe, that we're gonna be fourth or fifth year that we are having this in Atlanta. And this is the African American Male Wellness Agency, which is based out of Columbus, Ohio, I believe.
Okay.
And they have wellness walks in like all the major cities around the country. So
Hmm.
on September 14th, they're coming here to Atlanta. They're going to be at Morehouse College. It's from 7 a.m. to 12. So our goal is to try to get at least 500 Black men screened. So we're going to be doing all kinds of screenings: A1C, high blood pressure, STDs, kidney health, dental, vision, whatnot. Last year they said they had, I forget the exact number, but there were some men who realized that, found out that they had diagnosed, they didn't know that they found out they were diabetic, or they were hypertensive at the event. And so we
Hmm.
were able to get them and get them on a plan and connect them with the provider. So yeah, um, looking for people to come out and walk, come out and volunteer. I do believe we have some vendor spaces left, but yeah. So the website, and I can give that to you to send out. It is
Hmm.
www.aawellness.org/Atlanta.
All
So you
right.
can go on there and register a passion team to walk if you want. If you have an organization and you want us to come out and shoot a video of you that we're going to put on our social media saying that you love Black men and you want to, that you care about Black men's wellness, we can do that. Connect you with that and all that. So if anybody's interested, you definitely share my info, and they can reach out to me, and I can tell them how to get that done.
Okay. Awesome. Awesome.
Yeah.
So this is a lot of great information.
Yes,
Um,
man.
and I am going to make sure that I will link. I'm also going to share the flyer and put the website for people that want to walk or they want to be a vendor if there's any spots left, or
Mhm.
people that want to support. But I did want to ask you a question, Mr. Johnson. What is your passion and your why behind making sure that fathers are educated or are aware or are a part of this system where they're able to receive what you feel like they need? What is your passion behind that?
Well, I mean, just being a father myself, understanding, some of the things that my dad went through. Yeah, I talk about this briefly sometimes, but I never, my dad wasn't he wasn't an active part of my life. I mean, he never did anything to me. I love my dad, but
Hmm.
he would, that was just certain aspects of growing up or things like that that I was never taught. So when it came time for me and my children, my son and my daughter, I realized the things that I was lacking. And so, I had to learn a lot of things on, by trial and error and just going out and finding out on my own.
Hmm.
And so once I did that, I was able to, impart more of that, on, my children. So like I watch my son with my granddaughter and I see how he is based, as opposed to how I was, learning, not really understanding, and then thinking about, how my, just like the few interactions I had with my father, I just realized that, a lot of the mistakes that I had made over the course of my life was just things I just didn't know. And so it's like, well, I'm pretty sure that many of the other, dads out there, it took me a long time to just really come to a realization to get to a point to where the things that I was doing was actually effective and working. So I just say, well, I had to do it on my own. It took me a lot of time. So if I could just reach back out and, reach back and help some of the younger guys come through, because one thing I tell my kids always like, you're going to have to go through, you're going to have trouble in your life anyway. So there's no need to have unnecessary trouble. So a
Absolutely.
lot of stuff is unnecessary. So it's like if we could just come together, that's my passion. And as I said, we can't support families by just supporting the moms and the babies. Like the dads have to be in there somewhere. So that's my
Absolutely.
passion. That's my why. And if I don't do it, nobody else will. That's why. Well, I don't want to say that. Is if we don't do it, nobody else will.
Absolutely. Absolutely.
Yes.
Somebody to stand up and be willing to fight that battle and pioneer that movement. So might as well be you, right?
Yes, ma'am.
All right. Well, that is the end of this interview. So for
Thank
people,
you.
no problem. So for people that are like, you know what, I like CareSource. I like what they stand for. I like the services that they have to offer. I like the benefits that they have to the community. Where could they go out and learn more about CareSource or fill out an application to be approved?
Yeah. Okay. Yeah. So you can go to www.caresource.com/GA. That'll give you all the information about CareSource, our different plans, the different plans and so on and so forth. You can go on the site to enroll, to make sure that if you're a member, to enroll in life services, the rewards program, my strength, things of that nature. If you want to apply, you step, I believe it's Georgia Gateway. So you have to go to DFAX, Georgia Gateway, whatnot, to get approved to apply. And once you get approved, definitely make sure you monitor your mail, because they're going to send us stuff in the mail. But
Mhm.
for more information about CareSource and the other health plan, other health plan options, and I believe in making sure everybody has all the information, then you're going to want to log on to www.georgia-families.com, and they will be the ones to let you to switch the plans, switch the plans, and what have you. So with that, and if anybody wants any more information about Fathers Matter, you can log on to www.fathersmatteratl.com,
Okay.
and that's it.
All right. Well, thank you
All right.
so much, Mr. Johnson.
Yes,
You'll
ma'am.
be hearing from me, or we probably gonna be seeing each other at another event. But thank you
Yes,
for
ma'am.
at Let's Talk Wednesdays today, and I will speak with you later.
All right. Thank you so much.
No problem. Bye.
Bye bye.